Now, more on how you are helping people half a world away. The average East African will live to see only 48 years. That compares to our life expectancy of 80 years on Vancouver Island. The #1 killers in Africa are malaria, waterborne parasites, and HIV. But prevention is saving lives through organizations such as the Aga Khan Foundation and its Partnership Walk. Channel's Meribeth Burton continues her series of reports tonight as we look at healthcare. Meribeth.
Hudson, imagine if you can that you can forget for a few minutes about Family Doctor's sophisticated hospital equipment and 24-hour staffed hospitals. Because in East Africa, some people are walking more than 20 kilometers to see a healthcare professional, not in a hospital, not with a doctor, but a small clinic staffed with only community nurses. The services may be scant, but with the help of the Partnership Walk and the long arm of the Aga Khan Foundation, Canadian aid is reaching the most remote villages in East Africa. The Mazeras Dispensary Clinic is a 2-hour drive outside of Mombasa, Kenya. Dozens of people from 10 different villages walk as far as 20 kilometers to see a community health nurse.
The most common disease here is malaria. Malaria and chest infections, skin diseases.
Babies are weighed to make sure they are thriving. Mothers and babies are given large vitamin A pills to combat deficiencies that lead to eye diseases. It's a simple operation, but it's complex too. The dispensary is run by committee with representatives of all 10 villages. Their vision of a clinic began 10 years ago.
We went to Aga Khan asking for advices on how better can we move from the dispensary level to health center level.
And they asked for money. The Aga Khan Foundation Canada said no, but then found a wealthy partner who would pay 90% of the building costs if the villagers came up with the rest of the money.
It took us 2 years to raise the 9,000 needed through hard work and advices from Aga Khan and other friends.
The Aga Khan Foundation lets the committee run the clinic but make sure the leaders are well supported.
We train the community health workers, identifying their roles and responsibilities, especially in regard to the health issues within the community.
This patient needs pills to fight tuberculosis. And in the next room at the small pharmacy, the pills are doled out in paper cones. Patients pay for their drugs unless committee members excuse the fee because of dire poverty. No one is turned away.
What we're trying to promote is evidence-based decision-making and letting the community take ownership of the health problems and work towards improving their health status.
4 nurses are on staff. At least one of them is away from the clinic a month at a time doing community outreach work. Thanks to effective community leadership, this level 2 dispensary is now financially self-sufficient. But that's not good enough for the community leaders here. They have a grander vision for their facility. They want an admitting hospital. The committee arranged to have an incinerator built to help them bring them closer to their goal.
Level 2 to level 3, this means the services will be added, especially like deliveries. We don't conduct deliveries here.
Now other aid organizations are using the Mazeras model to recreate other community-run dispensaries on the African coast.
I'm very proud. Being a volunteer, that is, I'm assisting my own people. My people are seeing that actually we are loved. Our people are ready to suffer because of us. See changes, have modern lives, have good drugs, have good facilities.
The Aga Khan University Hospital is in downtown Nairobi. Patients here are often international travelers and elite Kenyans.
30 million plus of population here, and perhaps only 300 to 500,000 people can afford health care here through HMO, so that's quite a significant load.
The university is not funded by the Aga Khan Foundation, but it does foster some of the same principles of empowering people where they live.
Trying to take existing doctors and make them specialists of our institution and giving them the opportunity to be trained here locally, rather than perhaps going overseas.
At the teaching hospital, there are advanced nursing courses.
Elevating nurses from their sort of diploma, from the diploma level to a BSN level, a bachelor's degree level.
Every student nurse works at his or her real job 5 days a week, then goes to school the other 2 days, and they're all raising children too. The Aga Khan University Hospital also has a state-of-the-art laboratory with a staff of 70.
This machine is counting blood cells, right? You can see here we have the white blood cells and their different shows.
Each lab service and every medical procedure comes with a hefty price tag, typically covered by insurance companies. The lab at Rahaleo Dispensary is almost laughably crude in comparison. This dispensary in urban Zanzibar is the first private public health clinic in East Africa. The government runs the clinic. The Aga Khan Foundation trains the administrators.
Our vision is to replicate Rahaleo to other public clinics so that they learn what we have from our experience, what we have done.
Rahaleo, which means feel good in Swahili, is taking its health message to the streets of Zanzibar. It's developed a peer-to-peer counseling program for teenagers.
We have a problem with substance abuse now. HIV/AIDS is also up, so they talk with their fellow youth on how to improve or how to prevent themselves getting those diseases.
Prevention and early intervention are now healthcare priorities, all done by East Africans for East Africans, with economic and intellectual help from the Aga Khan Foundation Canada. If you would like to make a donation to improve the lives of these people, help us. Log on to the Partnership Walk website. There it is on your screen. Sponsor a walker or sign up for your walk yourself. It takes place in 9 cities, including Victoria, at the end of May. Tomorrow on Canadian Aid in Africa, we go deeper into remote villages in Kenya and Tanzania. It was a stunning eye-opener to see people who are living on substantially less than $1 a day. Water, something we take for granted here, is what East Africans need most to have modern and, of course, healthy lives. Hudson?
All right, we'll watch for that. Meribeth, thank you. Much more to come tonight on 80 Channel News at 6. When we come back, entertainment and sports next.